Thank you for being here. My name is Amy Hedman-Robertson, and I teach in the public health promotion area at the University of St. Thomas. And I'm so pleased that I've got some students here tonight for the presentation, and so pleased for this attendance. I mean, this is a great turnout, and so thank you for being here. And thank you for Dennis, Cleta, and Stephen, and your partnership, and Amelia, and the work that you've done too. It's been a really great collaboration. And I'm just excited to share some highlights from some of the work students did last fall in one of the courses. And so the course that I taught is program planning. And so that's a course in public health where we spend a lot of time discussing needs assessment and how to and what are the best ways to gather input from community members about their needs, about their interests, as well as what are some of the health conditions and health issues that they are facing. And then that informs interventions and programs and services that we can focus on and try to offer to folks. So student names are listed on the presentation here, and here are their lovely faces, along with Dennis, Stephen, and Cleta when they visited class last fall. And so we're just very grateful for this partnership, and you know, the students really learned a lot. You can tell by their smiles here, they were really enjoying the opportunity and learned a lot. As Cleta mentioned, this collaboration really came from the Center for Common Good. Kelly Sardon-Garrity works in the center, and the center is a really unique aspect of the University of St. Thomas because they do a lot of focus on volunteerism, on community engagement. And so a lot of students are active and volunteering within the community, and they also work and support faculty and courses to partner with community organizations on different projects. And so I was introduced to your well-being ministry team through Kelly at the University Center for Common Good. And so our task last fall was to conduct a literature review to explore the literature that's been published on wellness, well-being, mental health initiatives that are taking place in churches and faith-based communities. And so some of the example guiding questions that we used to frame our work included: in what ways is well-being promoted within the church setting? And in what ways is mental health promoted within the church setting? So here's a slide about the method. Students were assigned into teams of 2 to 3 students, and they each were given specific topics that they were asked to do some research. And they searched Google Scholar. We've all searched Google probably if you're online, but there's a Google Scholar type of search that you can do that really tailors to research articles. So if you're ever interested in uncovering research, I encourage you to check out Google Scholar. And there's a lot of open access articles that are free for the public to read and explore through Google Scholar. We also made use of the databases available through the University of St. Thomas. We tried to find articles that were within the last 10 years or so, but some of them were a little bit more dated. And then students were asked to create a table, kind of summarizing the article, summarizing the population, the methods that were employed, the results, the findings, and what that might mean for Lumen Christi. And so all the articles then went to a second team, to be reviewed. So there was some double checking of the students' work there. Yeah, in addition to that too, also worth noting is we did spend some time looking online at churches and what are some of the services and programs they are promoting and advertising. So that necessarily the well-being and mental health programs that they are offering. And this is just an example of a few sites, just to kind of explore, often looking, up what type of outreach or what type of ministries they have. Sometimes the programs are buried a little bit, so you have to dig deep in the website to find that. This particular top one is from Bethlehem Lutheran Church. They also promote the Mental Health Connect, So they have that program that is also available here at Lumen Christi. And so they're doing some amazing things. We explored a variety of churches. I'm not going to cover all of that, but I just highlighted a few here. Eagle Brook is a large non-denominational church here in Minnesota, and they're doing a lot of outreach specific to mental health and providing support for folks. And then I had the opportunity to visit your church and meet Deacon Ed Schoner when he was here. And so I provided an image of the parish that he is at. And they provide mental health ministry support groups for people struggling or facing mental health challenges, but also for family members of those individuals. And so that included some of our work too, was exploring those websites. To begin, just a few definitions. Students noticed in the literature that health was often defined as being more than just physical health, so encompassing mental health and spiritual health. And we have well-being. You all have the Living Compass model, and so there's various models of wellness and well-being, but often they cover multiple dimensions. And so many of them have already been mentioned tonight: the mental health, the spiritual health, emotional health, occupational health, environmental health, and the list goes on. Financial health is included in there too. And so taking a look at all the different dimensions that impact our well-being is important. Another definition that we uncovered was faith-based health promotion, and that's this idea of intentionally integrating faith-informed content into health education and health promotion. And so that integration, is a powerful way to exemplify the role that spirituality plays in our lives and the interconnectedness of spirituality with our mental health, with our emotional health, with our physical health. And the faith-based health promotion can really, make well-being initiatives and efforts much more meaningful and relevant for folks, especially in a faith-based community. So a variety of health and well-being topics were highlighted in the research, and this is just a listing, and I'll share a little bit more as we go through the PowerPoint. But common topics: food assistant, food pantry, we saw that. Some are offering nutrition counseling and nutrition cooking classes, and that type of thing. A lot of mental health type of programs, support for individuals who are facing mental health crises, as well as training programs focused on prevention, suicide prevention, or recognizing people who might be in need of professional help. Physical activity is also noted in the literature. Churches are very creative in the ways that they are promoting physical activity in a variety of ways, and churches make oftentimes a really great space. Large rooms like this that can accommodate group exercise classes, and that sense of connectedness that can be carried out outdoors for hiking clubs or running clubs, that type of thing. So there's a lot of programs that were described there that focused on physical activity, and then also some focusing on chronic disease prevention and management, including asthma, diabetes control, screenings for blood pressure. And so a variety of different activities taking place, vaccinations and blood drives as well. So the students prepared a wonderful presentation kind of going through the research findings, and what I tried to do for tonight was try to take a step back and just look at overall observations that we can glean. And so I'll be presenting some of the big takeaways, I guess, when we look collectively at all of these articles. One is the importance of assessment, which your well-being and ministry team has done a really great job, has been very thoughtful about that, is making sure that the programs really stem from needs and interests of your community. And so that is something that showed up again and again in the literature, is taking the time to do a really purposeful assessment and understanding the people and what their interests and needs are, and even by different generations, recognizing those different needs. And so that definitely stood out in most of the studies, was just an important aspect of the planning, was to conduct a needs assessment. And that took the shape of surveys, interviews, focus groups, looking at existing programs too and what worked well, and is that particular parish or congregation similar to ours? What type of adaptations would we need to make? How can we tailor programs to our congregation? Another observation that emerged in the research was the importance of engaging people and inviting people to this work. And so I think Cleta mentioned in her introduction, there's a lot of research that shows the health benefits of church attendance, of spirituality to our well-being. And not necessarily understanding the dynamics underlying that completely. It's probably multifactorial, but church attendance and engagement matters. It can help us buffer stress, it helps protect from depression, and it is definitely a protective factor in many ways. And so it takes hospital environment is important. Research has shown that coming to church is good for our health, and I think what a great campaign that would be, right? Like if you're trying to attract people, like what a powerful message. Like, did you know coming to church can improve your health, right? And so some, especially with our younger folks who are really struggling oftentimes with mental health and loneliness and isolation, to really share this research with folks to recruit and provide outreach. Also, people are here and they're an attentive audience. So, opportunities exist to promote health and well-being with a faith context in the pews, in Sunday school, and support groups that are offered in a variety of ways, thinking about how can we integrate well-being into the work that we're doing. Interestingly, a Gallup poll from 2021 found that people who reported attending church regularly were more likely to rate their mental health as excellent when compared to people who did not attend church often. And we could look to some underlying explanations, I guess, for that. But the statistics are pretty grim right now. It is estimated that 1 in 4 adults currently have a mental health disorder, and that in one's lifetime, 1 in 2 people will experience a mental health disorder. And surveys of our young people, college students, as many as 44% are reporting depression. And so, when we look at the mental health challenges, very timely to have a mental health ministry. And according to Gallup, they released a report on mental health in 2023, and it was titled Faith and Wellness, the Worldwide Connection Between Spirituality and Well-Being. And they pointed out that the mental health crisis coincides with the decline in religious beliefs and practices that we are observing. And so at a time when researchers are learning more about how spirituality can be linked to better well-being, we're seeing a decline in the number of people attending religious services and church. That's a great point. And just to, so others and those online can hear, the audience member mentioned a Pew study that looked at projections of religiosity and spirituality, and that it's projected to further decline in the next 5 or 10 years. So thank you for sharing that. Another observation revealed in the research is that churches are providing important sources of help, which you already know and are probably involved in yourself, but sources of help and hope to individuals, families, and communities in immediate needs. And the research showed, a variety of different types of initiatives, including food drives, clothing drives, food pantries, providing transportation to church and even to medical appointments. And speaking again of Bethlehem, they joined partnership with Judson Memorial Baptist in Minneapolis, and they have a starfish ministry that actually provides support for people with financial crisis. And so if people are, facing needs with regards to paying rent or paying utility bills, or they have a program that is set up to help support that. And online, it does mention that often the funds run dry before the end of the month, and obviously some people don't get the services, but it is a ministry that they are doing and is completely run by volunteers, and they are providing financial help. Other forms of support would be curating and sharing resources and information and services available. The next slide takes a look at a variety of different types of health and well-being programs that are taking place in the church, focusing more on like the health education aspect, so nutrition classes, cooking classes, physical activity classes. Some churches have looked at policy changes, for example, in the types of foods that they serve, focusing more on healthy options or more inclusive options for people who might have allergies or special needs. Some churches, too, are utilizing organizations within the community for evidence-based lifestyle programs. And so being in the Twin Cities here, we have so many wonderful organizations like the YMCA and Arthritis Foundation and American Red Cross, and partnering with those organizations to bring in services and programs. And so a couple examples, the Arthritis Foundation has a program called Walk with Ease to help alleviate pain associated with arthritis. And they work with community groups to offer that program. The YMCA has a program focused on heart health. There's a variety of mental health agencies that provide training too, and so utilizing some of those nonprofits, is a great way to bring wellness and programming into the church. And so that showed up in the literature. A sense of connectedness too was often something that showed up with a lot of these type of activities, that people come and they enjoy the company of others and feel connected and feel a sense of belonging while they're learning about wellness. One particular program that was described in the literature that students wrote about was a program titled Women Empowering Women, and it was a physical activity program, Erin remembers this, where older female adults were partnered with younger females, and it was a pair relationship, and they engaged in activity together, shared and talked, and there was this mentoring type of relationship, intergenerational type of education and spiritual support. And so that was a pretty neat program to learn about. Another program was called Faithfully Fit Forever, and this one really focused on the mind, body, and spirit of parishioners. And it focused on older adults, and it partnered with exercise physiologists and parish nurses to implement the program. And it was, really just promoting exercise and physical activity, and impact evaluation showed really success there. It was replicated in 60 cities across 8 states. And people were highly satisfied with the program. And it really focused on incorporating holistic health, that wellness model, alongside with the faith-based organization and faith-based work. Another theme that showed up was recruiting and training champions. So those volunteers, those people that are really committed and passionate to this work, and are able to just energize others in the parish and recruit other volunteers to get involved. They do important work in creating and planning and promoting. And they take on a variety of different names, these champions. And so some of the research described clergy and the importance that clergy play. Our pastors are priests in being the wellness champion and prioritizing that, as a program. But also there were a variety of training programs where people could participate to become like a well-being leader within their congregation. And some of those names included certified health ministers, community health advisors, or lay health advisors. And so it took on different titles in the different articles, but that was a theme that emerged is that there were these individuals that were called and committed to doing this work. So one program too was called Heal the Sick, and this is from Wesley Theological Seminary, and they actually offer this training to anyone, right? And so you can become a health minister through this Heal the Sick program, and it focuses on health ministers. The certificate course is actually available online, and it is a little costly. It costs $575 per person, but they cover a variety of training in a 22-hour course spanned over several days that focuses on whole person health and focuses on healing and well-being. Another theme that emerged was providing education, and so I think I covered some of this previously, but just looking for opportunities to promote healthy eating, promote physical activity, promote mental health promotion. Maybe that includes recognizing signs and symptoms of somebody who might be struggling or facing a mental health crisis or mental health disorder, how to intervene in those situations, how to help that person get to help, having those difficult conversations. And I believe you are looking at possibly offering mental health first aid, is that correct? Yeah. That would be awesome. Mental health first aid is one of the evidence-based programs in suicide prevention, but it also covers eating disorders and anxiety attacks and a variety of different kind of crises that might occur for people that they face mental health-wise. Mental health first aid, great program. It's about 8 hours, so oftentimes it's spanned over a 2-day event. QPR, question, persuade, refer, is another gatekeeper training, suicide prevention. That can be done in 90 minutes, and that covers the warning signs and risks of suicide and how to have that difficult conversation. And then referral, looking for ways to connect people to help and support. So there's a variety of evidence-based programs that can be explored too and be implemented. Destigmatization was also something that showed up in several articles where efforts were there to talk about mental health, to normalize mental health struggles and challenges, and to encourage help seeking. And then, as Cleta mentioned, the Johns Hopkins Lay Health Educator Program. This is a 12-week course that was or is hosted by Johns Hopkins Bayview Medical Center. And here, lay health educators are volunteers from local congregations with no background in healthcare, but they are trained. And the courses are taught by internal medicine physician residents. And then once trained, these lay health educators go into their congregations and parishes, and they do a variety of different things based on what the needs and interests are of their members. So it might be planning a health fair, might be organizing health screenings, providing health education. And so this video showcases this program benefiting Baltimore City residents and highlighting the medical residents who served in this role.
We have this amazing initiative called the Medicine for the Greater Good initiative, and as part of that initiative we encourage all residents to participate in some sort of community-based projects. Probably most rooted in the Medicine for the Greater Good initiative is in fact the Lay Health Educator Program. So the Lay Health Educator Program trains residents to teach community members about these topics so that they can go out and disseminate important health information to their communities.
My name is Rhonda Cromwell, and I'm an executive and leadership coach. And I realized in working with clients how much their health would affect their ability to lead successful and effective lives. And because of that, I became increasingly interested in community health. And I happened to be on the internet one day. I came across the Lay Health Educator Program. And I signed up, and I'm so glad I did. And so today at my church, we're having a workshop on depression, just really understanding more about it, what to look for, and really how to get help and the resources that are available to them.
In folks that are depressed, there are some studies that show that their level of stress hormones, their ability, their body to handle stress does not work as well.
What I find so gratifying each year is first seeing the enthusiasm of the volunteers who are so eager to learn about important health issues and then take that information back to their congregations and communities. And second is hearing their deep appreciation for the medical residents who have served as their instructors.
One way we here at Johns Hopkins Bayview have improved the health of our neighbors and our neighborhoods is by reaching out into the community and partnering with churches where we take healthcare information. For those of you who are medical residents who participate in our lay health educator program, you'll get the experience of teaching people how to take healthcare information to the community. You may be able to get out into the community yourself and meet some of our neighbors in a different environment than the hospital environment. Most of the residents that have done this have found it an extremely rewarding experience.
This is one wonderful opportunity for residents to get into the community and see where health is really happening and make an impact where it really matters.
Some of the other big takeaways were opportunities to provide health services on site. So health screenings is an example, vaccinations, that type of thing. For people that might have challenges with mobility or might not be connected to healthcare resources. So, thinking outside of the box to be able to provide health services. Also mental health counseling, that's a service, an important service that showed up in the literature that was taking place in the churches. And so one big conclusion, we have limitations, we have several limitations in our work, but I'll skip over that. But one big conclusion too was just the importance of collaborations. And so that's why I'm so grateful for our partnership. But I think, we are rich with resources in our community, and there are opportunities to partner and collaborate with other organizations and other folks, who are equipped and trained and prepared and perhaps have the resources and time to do this work too. So taking some time to just explore, based upon the findings of the needs assessment, of course. There is a page that has a call for invitation and just ways that you can get involved and support. First and foremost, pray for this initiative, pray for this ministry, pray for the well-being of your community, but also consider ways that you can join in and support the community. And were we going to have question time, or do you want to do some discussion time in small groups?
I have a question. So you're saying that you had your students compile lots of different information about different things that churches are doing. And so was there some sort of list that was given to the parish so that, a year from now they can consult the list?
Yeah, definitely. So the students prepared a final report and a presentation that they delivered to these fine folks back in December. And some kind of takeaways and some recommendations.
Okay.
Yeah, definitely. Yep. Any other questions? Yes.
In the comment from my perspective, one of the things that personally with dealing with mental health within our family is for myself, who was not needing the help, but needing that has that mental problem, issues going on.
Yeah. So having some resources would have been helpful, or places to go for more information and support.
And support, right?
Yeah, definitely. Yes.
So on the education side of it, were there any articles about how discussions were held at parishes, how education was done, were there book clubs? Sometimes, it's safer for people to get together and talk about a book on neurodiversity or somebody else's autobiography of something, and that helps create community, and it helps educate people as well, and make contribute to destigmatizing this. And were there any studies about that?
Yeah, that's a great question too. I mean, I don't think of anything that came, but the research that we found was really dictated by our search terms, and so and we only had a limited number of time, and we're undergraduate students who don't have a lot of research skills built up yet. So those were some of the limitations. But these are really great questions moving forward to think about and to ask and inquire and plan. I really like that idea. I think churches are probably doing that around book clubs, and and that's a great way to approach it. Definitely. I've done a variety of suicide prevention trainings in communities and many churches in the Mankato area. And one thing that I observed was that it was often people that came to the suicide prevention training that had already experienced a loss, and so it's like, how do you capture the people that, to prevent, right? That, how do you capture their attention? How do you get them to attend these type of events? And that's a challenge with health and prevention, because it's not, usually we have to be afflicted or affected by it before we, are paying more attention to it. And so that's a challenge that we face in public health, I know for sure. Thank you all.
Yes, Amy, thank you so much.
I think what's evident from just the information that's been presented by Amy and Amelia got us going with some knowledge of our own community, which we have to pursue. There's so much here. So how do you distill it down to what will work for us? What is coming out is the importance of democratizing learning. So in other words, versus little specialist groups, the more we can democratize things like mental health, what do I want to say there? The training on mental health. What's the name of it? Yes, thank you. Mental health first aid. I mean, we can't have a single person everywhere, right? Mental health first aid is a way to, if we democratize things like democratizing the concepts behind Stephen ministry. How do you accompany somebody who's struggling? They got depressed, they're not going to stay depressed necessarily, but how do you work with them? How do you walk with them? So there is this now movement out in organizations to democratize these kind of learning. So what we need to do is find out what are the concerns of our parish, what do we care about, and what should we do first, second, and third to help ourselves and further build a community. And then how do we get to our younger people? That's so important. Because right here, it's, you attend church, you're going to be better off, So, we're going the opposite direction. So how do we work with that? In fact, Dennis and I just want to say this last thing. We were at St. Thomas, and we walked by a bulletin board, and they had shooting instructions. And Dennis and I looked at each other, and we thought, active shooter instructions. And it was so sobering for me to see. I mean, my sister's a teacher. She talks to me about it. But just to see it up on the wall, it's nothing I ever had to deal with. And it's so scary. So we're in a different world. We need to understand the world we're in and how we can be helpful to each other in our community. So thank you so much for attending tonight. Thank you, Amy. That was an excellent review. There's so much there. I definitely have to make that available. And thank you so much, Amelia, for getting us on the data journey. We have a ways to go. We have to dig some more things out, but I would really appreciate everybody being here tonight and starting the journey with each other. All righty. Thank you.
Thank you.